People often think you look upset even when you are not? It may not be your mood, but subtle facial muscle tension that's shaping your expression. With the right carefully tailored treatment, you can achieve a more relaxed and approachable look while still looking natural. Join Anna Hu channel live session as we share what's really happening and how to address it safely and effectively. See you there!
Dull-looking skin, unhealthy skin texture. These are inevitable signs of aging that we all face, but we can slow down the process. Introducing Collagen Forte combines our signature 4-in-1 active ingredients. It helps improve overall skin health by hydrating and firming your skin. It also protects your skin from inflammation and UV damage, while promoting collagen and elastin formation for healthier skin. Collagen Forte. Transform your skin for optimum well-being.
Do people often think you look upset even when you are not? It may not be your mood, but subtle facial muscle tension that's shaping your expression. With the right carefully tailored treatment, you can achieve a more relaxed and approachable look while still looking natural. Join Anna Hu channel live session as we share what's really happening and how to address it safely and effectively. See you there!
Dull-looking skin, unhealthy skin texture. These are inevitable signs of aging that we all face, but we can slow down the process. Introducing Collagen Forte combines our signature 4-in-1 active ingredients. It helps improve overall skin health by hydrating and firming your skin. It also protects your skin from inflammation and UV damage, while promoting collagen and elastin formation for healthier skin. Collagen Forte. Transform your skin for optimum well-being.
Welcome to the Anna Hu channel live. Hi, I'm Dr. Anna, Medical Director and founder of Anna Hu Clinic in Malaysia. This is a space where we explore the science behind medical wellness and medical aesthetic in a holistic, thoughtful, and more practical way. Today, we are discussing something very commonly known but often misunderstood: botulinum toxin A and facial muscle relaxations. Most people think botulinum toxin A, or commonly known as Botox or Dysport, is just about removing wrinkle. But in reality, it's much deeper than that. It's about how your facial muscle shape your expressions, your mood, and even how other people perceive you, but more importantly, how you see yourself. If you have ever been told that you look tired, angry, or stressed, even when you are not feeling that way, these sessions may be a sessions for you. And we are going to break down how muscle activity affects your appearance and how precise muscle relaxations can restore balance, softness, and natural expressions of the face. Before we start, let me ask you something. Have you ever considered botulinum toxin A or Botox or this spot before? A, yes, I've tried it. B, I'm curious but still unsure. C, I'm worried it will look unnatural. D, I'm anxious and I'm not keen. Type A, B, or C and D in the comment. I want to see where everyone is starting from. Why facial muscle activity change how you look and how you are being perceived? Have you noticed that some people look constantly tired, angry, or stressed? Even when they are completely relaxed, they will tell you, I'm relaxed. But when we are looking at their face, there is misalignment between what they think they are and the real facial expression. This is not always about aging skin. It's often about overactive facial muscle, or in another word, chronic muscle spasm. When the patient or someone is constantly under stress, the muscle is constantly contracting. And this happens not only to facial muscle, it's also happened to the neck muscle, to the shoulder muscle, and including to the back muscle as well. But today, we are going to focus more on the face, something we can see and perceive easily. Certain muscles in the face are constantly contracting, even when they are not aware of it. It's a subconscious act. Over time, repeated muscle movement, it will create dynamic wrinkle and muscle enlargement. So there are static dynamic wrinkle and just pure dynamic wrinkle only. So it's depending on how long the existence of the muscle movement which created the wrinkle. But more importantly, it can create a fixed emotional expressions. For example, a very simple one. The frown muscle over here can make someone look permanently tense. And if someone is constantly contracting the frown muscle, the muscle, it will get bigger as time goes. And not only the wrinkle become obvious, the muscle bulk will become obvious as well. For the forehead muscle line, which is around this particular area, so forehead muscle can create a worried or stressed appearance. At the same time, when someone is constantly tired, for example, when they need to raise their eyebrow up, to pull the upper eyelid up, so for this group of patients, they will have dynamic wrinkle for the start, then permanent wrinkle eventually. Then the next area, which can be related to emotions, at the same time, muscle bulk is the corner of the mouth. So the mouth corner can be pulled down by one of the muscle called DAO. So if this muscle is constantly contracting or in muscle spasm, it will give a very stressed appearance or very tense, even around the chin area. So this stress and tense, strong muscle, it will give a sad and frustrated appearance, having said the patients are thinking that they are fully relaxed. So even if you feel good emotionally, your face may be sending a different message. But before we dive deeper into this topic, let's watch a short video about botulinum toxin A, Botox, Do you know that in 2024 alone, close to 10 million non-surgical botulinum toxin A treatments were performed worldwide? While many people are still asking, is it safe? Will I look natural? Botulinum toxin A has already been used for more than 30 years, helping millions to slow down facial aging safely and effectively. So today, let's break it down simply. What exactly is botulinum toxin A and how does it work? Botulinum toxin A is a purified pure protein. It is also known by different brand names such as Botox, Dysport, Xeomin, and others. But medically, they all belong to the same family, botulinum toxin A. So when we say Botox, for example, or Dysport, for example, it's actually a common name used in the industry. Originally, in the 1970s, botulinum toxin A was used for medical conditions like eye muscle spasm, neck muscle spasm, strabismus, something like a cross eye, cerebral palsy, which related to muscle tightness. Only later did doctor discover something interesting aesthetically. In the 1980s, ophthalmologists noticed something unexpected. After treating patients' eye muscles at movement, they found that the wrinkles around the treated area became smoother. That was the beginning of botulinum toxin A use in medical aesthetics. In 1989, the US FDA officially approved botulinum toxin A for medical use, and later, it became one of the most important tools in modern medical aesthetics. What can botulinum toxin A treat? Botulinum toxin A works by relaxing overactive facial muscle. It can help improve frown lines, forehead lines, crow's feet, gummy smile, masseter muscle, and in some studies, it can be used for shoulder slimming, calf slimming, facial lifting, and hyperhidrosis. The goal is not to freeze the face, but to soften overactive muscle movement for a more refreshed look. So how do we actually perform botulinum toxin A? First, we carefully assess the facial muscle movement. Which muscles are overactive? Which expressions are creating the wrinkle? And how your face moves naturally. Then we design a personalized treatment plan. Using a very fine needle, carefully plan the amount of botulinum toxin A injected into specific muscle at a specific depth. The depth also makes a significant difference on the results. The procedure is quick, usually 10 to 15 minutes, minimal downtime, minimum discomfort. After injections, the muscle gradually relaxes over 3 to 7 days, and full effect appears around 1 to 2 weeks. One very important point, brand and safety matter. We always recommend using registered botulinum toxin A, which is approved by the Ministry of Health of individual country. FDA approved botulinum toxin A brand, officially imported medical grade toxin. Please avoid unregulated or illegal products, even if they are cheaper. I would think your face deserves safe and quality product. Why is this so? Because it's your appearance that we are talking about, which the product result typically lasts 4 to 6 months. That makes safety and quality non-negotiable. If budget is tight, it's often worth waiting to invest in something properly reputable rather than taking unnecessary risk with your skin and face. How long does botulinum toxin A result last? Botulinum toxin A results usually last about 4 to 6 months. After that, the effect gradually wears off naturally. The good news is, it does not permanently stay in your body. There is no long-term accumulations of product, and with regular treatment, results can become more stable over time. Their studies even shows that with consistent treatments every 4 to 6 months for a few cycles, the results can be maintained in a longer periods of time. Botulinum toxin A is not about changing your face. It's about relaxing overactive muscles so your natural expressions look more refreshed, balanced, and youthful. Welcome back to the Anna Hu channel live. I'm Dr. Anna, here to help you look and feel your best. If you have questions during the sessions, pop them in the comments below. We select 5 viewers to receive our complete essential kit, and I'll address your questions live. What's in the kit? NMN, 5 sachets which good for energy and cellular health. The second product will be collagen C Forte, amounting to 4 sachets to help the skin to look glow and firm. Plant Pro Plus, 3 sachets for daily nutrition and gut support. This kit is packed with essential to help us feel and look our best inside and out. Many people think botulinum toxin A is simply about eliminating wrinkle, but at Anahu Clinic, we see it at a different angle. Let me put it this way. Our approach is more holistic. We don't just look at individual lines on the face, we look at facial harmony as a whole and facial muscle expressions enhancement in more specific way. Because the goal is not to erase facial expressions or line, but to enhance, at the same time allowing us to express ourselves at the optimal conditions. It's to help you look naturally refreshed, balanced, and still very much like yourself, just without the tired or tense appearance. So once we understand that, the next question is, what are we actually treating with botulinum toxin A? Let's break it down. One of the most interesting concepts we talk about is something we call the emotional detox of facial muscle. Now, this is where it gets really fascinating. When we relax certain overactive muscle, especially the frown lines between the brow, it's not just about smoothing wrinkle. They are actually a psychological concept called facial feedback mechanism. It suggests that your brain doesn't just control your facial expressions, it also reading the facial expressions, the muscle tensions, the energy carried by the muscle. So in simple terms, if your face is constantly in a frowning or tense positions, your brain may actually interpret that as stress, even if you don't really feel stressed. That's why when we gently relax this muscle, we often see 3 things which will happen. The face looks softer, the expressions become calmer, and some patients even say they feel less tense emotionally. But just to be clear, it's not about changing who you are. It's more on releasing the unnecessary emotional load the face has been carrying for years. Now, this also explains something very important. Why a one-size-fits-all botulinum toxin A approach doesn't really work. Because facial muscle activity is actually quite complex. Some muscles can be overactive as time goes by. Some muscle might be underactive. And some are literally pulling against each other. If we just block everything, the face can end up looking flat or unnatural, which is not what we really want. At Anahu Clinic, what we focus on is these combinations. Precise muscle relaxations on the tense muscle. The moment when we relax those muscles that pulling the face up, down, then it will be able to allow the muscle that pulling the face up work with less energy required. By doing so, we are aiming to hit a facial muscle activity balance, allow the muscle to work easier to lift the face up at the same time to reduce the pulling down strength. Not to freeze the expressions, at the same time not to erase their facial emotions, but to allow the patients to be able to express the relaxed, the elegant, and the joyful versions of themselves. So this refining how the face muscle going to moves. Now, let's Let's talk about something many people overlook, the lower face. Most people think botulinum toxin A is only for the forehead or the frown line or the crow's feet, but actually the lower face also play a huge role in facial expressions. Let's go through a few examples. First, botulinum toxin A able to help the lip flip. When we gently relax the upper lips muscle, there will be less tensions on the upper lips muscle when the patients put their muscle in a contractions manner, and the lips can roll up slightly outward easily. So instead of adding volume, so sometimes when the patient's presented with a very thin upper lips and they are not keen to use volumizing fillers to enhance the volume, botulinum toxin A can be one of the options the patients might consider. So by using the botulinum toxin A, the patients might get a softer, subtly fuller upper lips, a more natural enhancement, and not or without filler use in some cases. So another example like gummy smile corrections. So sometimes when the patient smile, then it will show up a big portions of the gum area on the upper or sometimes even the lower part of the mouth. So now we are focusing more on the upper gum rather than the lower gum. So when the upper lips flip too high, when someone is smiling, we can relax the muscle that pulling it up slightly so that to hit the balance where it will show less gum, eventually will give a more calmer and a more relaxed and natural expressive smile. Another case that we can talk about, it will be the muscle of DAO, the muscle that pull the corner of the mouth downwards. So when this muscle is overactive, the angle of the mouth, it will be pulled down, even at rest, especially when the muscle is in spasm. So the face can look a bit sad or tired, or sometimes it will be interpreted as frustrated. So when we relax this DAO gently, it will reduce the pulling down energy of the angle of the mouth. Reductions of volume or energy in pulling down, the antagonized muscle, the muscle that pulling up, can work easier. So this will contribute to better resting expressions, and the patients will look softer rather than tense, angry, or frustrated. And the overall facial emotions will appear more approachable, more inviting, and more positive. Finally, let's talk about facial symmetry and balancing. Because no face is perfectly symmetric, and that's completely normal. But sometimes we do notice patterns like one eyebrow moving higher than the other, one side of the face being more expressive, stronger muscle movement than the other, or one muscle working harder due to habit. With targeted muscle relaxations, we can help to balance the eyebrow positions, reduce the overactivity on one side of the face, and improve overall facial harmony during expressions. And I always remind patients of this. This is not about changing your identity. It's about restoring balance in how your face muscle move, so it looks harmonious from every angle. And these harmonizations of facial expressions will invite luck, invite joy, at the same time invite healthy connections to the community or the social circles that they are in. So thank you very much for the questions. And if you have any questions on your mind, this is the perfect time to share them. Please don't be hesitant and leave your questions in the comment below, and I will come back to them in a moment. As a small thank you, audience who ask questions tonight will stand a chance to win our complete essential kit. We will be selecting 5 lucky winners. Let us begin with a questions that come out almost every single week in my clinic. Can Botox jab under eyes if eyes look tired with dark circle and eye lines? Okay, so botulinum toxin or Botox is not typically injected under the eyes to treat dark circles. It's mainly used around the eyes to soften the crow's feet, which is the wrinkle around the side of the eye, and to relax the muscle between the brow and inject directly under the lower eyelid. It carries a higher risk of drooping eyelid and other complications or under eye puffiness. So it's generally avoided. What to consider instead if you do have lines directly under the eye? If dark circles are from shadowing of pigment, they won't respond to botulinum toxin A. So treatments that may help include topical depigmentation agent, creams that you can apply underneath the eye, laser or light therapy, or skin tightening procedure. Or skin hydration treatment also can be helpful as well. So if wrinkle under or around the eyes are the issues, usually doctors will treat the crow's feet area and the area around the eye with botulinum toxin, or consider hyaluronic acid fillers or dermal fillers for volume lost in the tear trough, or hydrations of the skin itself to reduce the hollowness that casts the shadow. So another example are like puffiness or swelling under the eye. Botulinum toxin A or Botox isn't a fix for that. So other options that can help for puffiness or swelling under the eye are like lipase enzyme, collagenase, or in certain serious cases that maybe the patients can even consider eyelid surgery. And for mild cases, they might consider lifestyle or allergy management. Okay, hope this answers your questions. So the other questions that we have here are, how long do the results last? So most patients or most people, they do see noticeable result within 3 to 7 days, with the peak effect around 2 weeks to around like 2 months. So after that, the muscle will regain back the activity, or the muscle actions will be coming back, and around like 3 months plus or minus, usually patients will realize that, hey, my muscle is coming back, my muscle movement is coming back, and the dynamic lines is coming back. So about 3 to 4 months time, they might notice when they smile, the lines is gradually coming back, but not as severe as before. And after like 4 to 6 months time, the wrinkle might be there, but still not as serious as before. So what we normally will do is we will suggest some maintenance injections are usually needed to sustain the result. And again, we are not aiming for no lines at all. We are aiming for long-term maintenance so that we preserve the muscle bulk. At the same time, we manage the muscle activity to prevent formations of dynamic wrinkles. Okay, hope I answer your questions. Then let's look at another questions. How to avoid wrinkles and fine lines naturally? Oh, okay. So let's go back to lifestyle adjustment. Then the most important lifestyle that maybe we would like to cultivate are the utilizations of sun protections. The sunblock. Use a broad spectrum sunscreen, SPF 30 and above. We can also use a physical block like wear hats and then seek shade and reduce the UV exposure while we are driving. And because over sun exposure, it will trigger wrinkle formations. Skin routines like clean the face gently and use antioxidant serums. My personal preference is resveratrol serum, or vitamin C serums in combinations with vitamin E. These antioxidant serums will be able to help to protect and hydrate the skin. At the same time, it can also support collagen regenerations as well. So, not besides the antioxidant serum, there are some medicated skincare product which can be of helpful. For example, like retinol product, usually will need to start slowly, especially for those people with sensitive skin. And this will help to promote collagen regenerations and cell turnover. And however, the use of the product will need to be discussed with your healthcare practitioner, especially if you have sensitive skin. Maintain hydrations with a good moisturizer. Consider humectants like hyaluronic acid. Hyaluronic acid, not only we can use it as injectable fillers, it can be also used as moisturizers to protect the skin. And not to forget, drink plenty of water. Hydrations, it's important. Eat healthy diet. A balanced diet will support skin health. Limit sugar. Glycations will lead to fast aging of the skin. Reductions of processed food, which may contribute to aging of the skin as well. And that is a small tips that I can offer you, which I'm doing daily. It's to increase the dosage of the omega-3 fatty acid intake. Omega-3 fatty acid, essential fatty acid, will be able to assist in maintenance of good hydrations of the skin. Other lifestyle adjustments are like don't smoke, reduce alcohol intake. The reason why is smoking and alcohol intake, it will accelerate the wrinkle and skin aging. Get adequate sleep, manage stress, and at the same time, love yourself and treat yourself well. So, facial movement habit, and be mindful of repeated facial expressions. Check whether do you frown frequently. If you do, maybe you need to reassess the reason why frowning. So check the power of the eye, because the commonest reason why patients frown are because of their eye power and they need to focus while they are looking or reading. So over time, in the long run, quick tips, hydrations and skincare help, lifestyle adjustment help, and change or improve certain lifestyle behavior that helps a lot as well. Then let's look at the next questions. Okay, what does Botox treat and how does it work? So Botox is actually a brand, and the products in the Botox is called botulinum toxin A. So what does botulinum toxin A does? It is a purified pure protein that will block the nerve signals to a targeted facial muscle. And this, it will reduce contractions that cause wrinkle. And it's commonly used to smooth frown lines. And the other indicator are crow's feet lines and also the forehead lines. And sometimes it's also used for some medical conditions like excessive sweating, especially the armpit excessive sweating. It can be used or documented that it can be help of migraine or even in muscle spasm as well. So let's look at the other questions. Okay, is Botox safe? What are the commonest risks or who shouldn't get it? So generally, botulinum toxin A it's generally considered a very safe treatment when administered by a qualified healthcare practitioner. So common side effects are temporary and may include redness, swelling at the injection site, or tiny bruises, or some patients, they say that the needle marks is obvious. So other adverse reactions, it could be asymmetrical facial muscle movement, especially when we compare it the right and the left. And if do not get botulinum toxin A if you are pregnant or breastfeeding, and have some neuromuscular conditions or have allergic or previous history of allergic reactions towards botulinum toxin. So if you are in doubt, please don't be hesitate to consult your healthcare practitioner because they will be able to perform a proper assessment for you. Okay, so another questions are like, let's see. So what should I expect during and after the procedure? So generally, botulinum toxin A treatments are it's a treatment which required around like 5 to 10 minutes, but sometimes to make sure that the patients are more comfortable, what we normally will do is we will apply numbing cream. So applications of numbing cream itself will reduce the discomfort while we perform injections of botulinum toxin A on the skin. And during the sessions, patients usually may have slight tenderness or discomfort at the injection site. For this, numbing cream will help a lot. Avoid rubbing the treatment area for about like immediately after until 24 hours later. And we usually will suggest the patients to avoid exercise immediately after that or to stay upright for several hours. And most of the time, patients will be able to visualize. For some sensitive patients, they might immediately visualize the result. And some patients, they will gradually visualize the result in 3 to 7 days' time. Optimum result, like what we have shared before, usually is around like 2 weeks to 2 months. And gradually, the muscle will regain back the functions. Okay. And the commonest questions that usually patients will ask immediately after the treatment is what should I do and what shouldn't I do after botulinum toxin A treatment or after a Botox treatment. So after Botox treatments, we usually will suggest the patients to keep the treated area cleaned and dry. And at the same time, we will also suggest the patients to not exercise immediately after. And we will also suggest the patients, if possible, do not fly on the same day. And at the same time, we will also suggest the patients to apply moisturizer. And for some patients where there is a risk or there is already evidence that they might have bruises, we will give them some healing cream with the arnica content, which will help to reduce the bruises fast. And after the treatment, we usually suggest the patients do not use potential contaminated cloth to clean the face and try to use as clean and as sterile possible cloths to wipe the face, and don't wipe or massage it roughly, just gently will do. And do not stay upright. Do stay upright and avoid lying down flat for about 4 hours after the injections. Okay? So, and another questions that maybe we can work on. Do I need to repeat the botulinum toxin A or Botox treatment for the rest of my life? Okay, so this is also one of the questions that I ask myself as well. Will I constantly inject Botox until when I get older? So, from personal experience wise, I have been getting my face treated, started since age 31. And I would think that this is such a thoughtful question. And the answer is not necessarily. This is by choice. It depends on what type of expectations that you set for yourself. Just in general, botulinum toxin A is not a permanent treatment. Okay? It's not a permanent treatment. It is kind of like, do you need to repeat your facial all the time? It's kind of like the same idea. So what the toxin will do is, after the injections, the muscle will respond towards the purified pure protein, and then the muscle will get relaxed depending on the dose, either fully relaxed or partially relaxed. And this result will typically last around like 3 to 6 months. So the exact durations generally is depending on several factors. For example, the thickness of your skin, your bone volume, your fat pad thickness, and the muscle mass or the muscle tone right from the start before the treatment. So to help to preserve or to help the Botox or botulinum toxin result for it to last longer, I would propose lifestyle adjustment is extremely important. So reduce stress level, get enough sleep, hydrate the body well, and then hydrate the skin well. All this, it will assist for the botulinum toxin result to be able to last longer, because by doing so, we are reducing the speed of aging. So if your goal is to maintain a consistently smooth, refreshed appearance, then yes, periodic top-up treatment will help you preserve those results over time. However, I do not recommend continuous injections of botulinum toxin every 3 months once. The reason why is observation and assessment is extremely important. If we did not allow time for the muscle to regain back the activity again, what will happen once the muscle is being relaxed for too long, the muscle eventually will become thinner and thinner. Thinning of the muscle eventually will lead to volume loss, and volume loss will make us look older. So it's like facial. If we overdo it, the skin will get sensitive as well. So it is extremely important for us to have a proper treatment plan and assessment from time to time, because we might not need to repeat it every 3 months once, or occasionally when we are in good health, or when we are treating ourselves well. So the interval may be between like 3 to 6 months once, or sometimes even 7 to 8 months once, depending on what do you want to achieve. So there is no single right answer, and there is no wrong answer for this as well. Then only the one that align with your goal, your value, and your stage in life, that will help you to decide how frequent do you need to repeat the treatment. Okay? So please keep your questions coming. We will return to them in just a moment. So now let's continue with another round of educational video. And before we go deeper to tonight's topic, I would like us to watch a short educational videos together. This video will explore questions many of you have asked me. Why do some people end up looking frozen or overdone after botulinum toxin? More importantly, how can we as both practitioners and patients prevent that and instead achieve a natural, balanced, refreshing results? Hi everyone, I'm Dr. Anna from Anna Hu Clinic. Botulinum toxin A is one of the most widely performed aesthetic treatment in the world, but at the same time, it's also one of the most misunderstood. Many people ask me, Doctor, is Botox safe? Why do some people look frozen? Why do eyebrows sometimes look uneven after treatment? Today, let's break this down clearly so you understand what's normal, what's avoidable, and what actually causes these results. Is botulinum toxin A or Botox safe? First, let's be clear. Botulinum toxin A or Botox has been used medically for over 30 years. When it is properly diluted, properly transported, and properly injected and performed by trained medical professionals, it is generally considered safe with a very low complications rate. Most side effects, if they occur, are temporary and reversible. But like any medical procedures, the treatment technique matters a lot. Why do some people look frozen after botulinum toxin A injections? Now let's talk about the frozen face effect. This usually does not happen because of botulinum toxin A itself. It is not dangerous. It happens because of either overdose or poor treatment planning. There are three common reasons. Number one, either too much dose. If the muscle is completely over-relaxed, expressions become overly stiff. Second, it could be because of incorrect muscle selection. If we treat all muscles the same way, we lose natural movement patterns. Third, ignoring facial balance. The face is dynamic. Some muscles need to move slightly to keep expressions natural. So when everything is fully turned off or paralyzed, the face can look flat, frozen, or emotionless. At Anna Clinic, we always aim for controlled relaxations, not complete eliminations of movement. So sometimes we will share with our patients, it's okay to have a little bit more line, especially the line at the angle of the eye, for us to connect with people when we are happy and joyful. Why does eyebrow become uneven? Another common concern is eyebrow asymmetry after botulinum toxin A. This usually happens because one side of the forehead muscle is naturally stronger, or injection dosage was not balanced, or facial asymmetry was not assessed before treatment. When one side relaxes more than the other, the stronger side may pull the brow higher. That's when people say, "Doctor, my eyebrow looks lifted on one side but not the other side." But in reality, it's a muscle imbalance issues, treatment planning challenges, and not a botulinum toxin A complications on its own. We usually will do a touch-up to balance back the asymmetrical muscle movement, and this can be resolved within a week. How do we prevent frozen face or uneven results? It comes down to three key principles. Detailed facial assessment. We don't just look at wrinkles, we study the muscle movement, the strength, and the symmetry. Second, precise dosing. Different muscles need different level of relaxations, not a one-size-fits-all approach. Third, preserve expressions balance. We always aim to keep some natural movement so the face still feel alive and expressive. This is extremely important because our aim is not to eliminate all the wrinkles. Our aim is to assist our patients to express themselves better. The goal is simple. You should look refreshed, not treated, and they are able to express their emotions better after the treatment.
Dull-looking skin, unhealthy skin texture. These are inevitable signs of aging that we all face, but we can slow down the process. Introducing Collagen Forte combines our signature 4-in-1 active ingredients. It helps improve overall skin health by hydrating and firming your skin. It also protects your skin from inflammation and UV damage, while promoting collagen and elastin formation for healthier skin. Collagen Forte. Transform your skin for optimum well-being.
Okay, welcome back. So there's another questions here that asked by the audience. Why do some wrinkles look more obvious when I smile or make expression? So these are something that concerning many people. Not everyone will take actions, but it's questions that we should consider answer. So there are a few reasons why wrinkles become more obvious when you smile or when you make an expressions. So one of the commonest reason, or when we are looking at wrinkles, we are looking at whether is it a dynamic wrinkle or is it a static wrinkle. So what is dynamic wrinkle and what is static wrinkle? Dynamic wrinkles appear when we are in animations. For example, when we smile, sometimes you will notice that the wrinkle at the crow's feet area, or when we frown, there might be wrinkles at the frown lines, and usually there's the 11 line, which is the most common terms that described by the patients, or when the patients in surprise facial experience, like opening up the eye, the horizontal lines on the forehead. So all these are dynamic wrinkles. Whereas static wrinkles are when we are in resting positions. So some of the fine lines underneath the eye, or when we are in resting positions, or when some of the lines at the anterior cheek, all those are static wrinkles. So dynamic wrinkles usually are from repetitions of facial muscle movement when we smile, when we frown, when we raise our eyebrow up. So when we relax, this dynamic wrinkles, some may fade, but as we age, because of frequent movement, those dynamic wrinkles eventually it might become evidence or it might stays. So muscle activity, when you contract the muscles around the eye, mouth, forehead, and the skin fold or crease more over time, this fold can be deepened as collagen and elastin decline. So besides dynamic and static wrinkle most of the time are due to skin aging and collagen loss. So usually static wrinkles are caused by over sun exposure, smoking, and natural aging due to collagen reductions because of decline in hormones, especially estrogen, which will reduce the hydrations in the skin. So less support means wrinkles appear more pronounced during movement and stay more visible at rest. Besides that, volume loss and fat redistribution is also one of the reasons why we are having prominent wrinkle. So especially loss of fat, facial fat. Hollow area or sunken cheek can cast shadow, especially the Indian line or what we call as the nasojugal line. So, or the tear trough underneath the eye. And sometimes when we smile, the patients might notice that there is a prominent bulk besides the nose and under the eye area with the indentations. That is also something that bother quite a lot of people. And the reason why this is happening is because most of the time is atrophy or reductions of the fat pad. So skin eczema, which directly related to skin hydrations and texture, because of dry and rough skin fold, may be also one of the reasons the patients have static wrinkle or static lines. So in some cases, even in younger individual, while we are taking photo, so the lighting and angles or the positions where we stand underneath the light, which casts the shadow, will be also one potential reason why we might notice additional lines or additional shadows which worrying us. Okay, hope I answered the questions. Okay, now I did prepare some of the case studies, and now I would like to share a real case from my clinic and one that beautifully illustrated how botulinum toxin A can do so much more than reduce wrinkle. So in this case, we use targeted precise botulinum toxin A or Botox treatment to address subtle facial asymmetry and gentle lift area that have been pulled the face into a tired or sad expressions. And this time round, the case studies that we are going to discuss are from a male patients rather than from a common patient itself. As what you do see here, so the area where there is a cross are the injections point. So the treatment area are forehead. Usually there will be 5 injection point. The area that around the frown lines, which we call a glabella complex, and that will require around like 5 injection point at the same time. And the area around the crow's feet, which is the lateral eye dynamic wrinkle, which each area we might need to do like 3 injections points. So every single injections point, it's roughly about 4 unit of botulinum toxin A. And in total for the full face, we have treated the patients with 64 units of botulinum toxin A. So now, let's have a look of a comparisons of before and after treatment results. Let's have a look. Now, can I get the before and after photo results out? Okay, So if you do assess on the patient's face, when the patient's in animations, at the moment he is smiling. So while he's smiling, there is a dynamic wrinkle at the side of the eye. So 2 weeks after the botulinum toxin A treatment, you do notice that the lateral angle or the crow's feet have reduced significantly, almost like 70 to 80%. Besides that, I do hope that you are able to observe, besides wrinkle reduction, by relaxing the muscle around the eye area, we will allow the patient's eye to be able to open slightly bigger. So can you see the difference in the eye size on the right and left? If you do see, can you please type yes? Let me check. If you do see the difference, can you please type yes? Okay. So while waiting, then we can proceed to the other parts of treatment. So thank you, Wong. Then we can proceed to the next before and after photo, which is, let me see, the frown lines. So now looking at the latest before and after photo, while the patient is forcing himself to frown, besides the wrinkle at the frown or the glabella complex or the frown area, you do notice that the patients do have enlarged muscle mass. Can you see that on the before treatment results? So now let's look at after 2 weeks. So for the after 2 weeks, there is significant reductions in muscle movement. I wouldn't say that this is 100% wrinkle eliminations, because the patients started with big muscle bulk with hypertonic muscle tone. So now I'd like to share certain informations. If we fix the dosage for the patients, for example, 4 units at each injection point, for the muscle which is XXL size versus muscle of XL versus muscle of L size versus muscle of M and S size. So the 4 unit of botulinum toxin A, it will work very well for S, M, and L size. However, when the muscle is XL or when the muscle is XXL, then the 4 unit might not be able to 100% or totally relax the hypertonic muscle. So, however, do not get too worried. So, because having said the muscle is not fully relaxed, however, the relaxations will be able to allow reductions in muscle movement. And if you do notice on the before and after, can I get the same photo up again? So you do notice when the patients try to frown, the muscle mass becomes slightly smaller. So now I'd like to discuss with you the short-term aim and the long-term gain of botulinum toxin A. So short-term aim is to reduce muscle movement, then eventually we'll be able to reduce the wrinkle. Long-term gain for the botulinum toxin A, by repeating treatment or even by just one single sessions of treatment, relaxing of the muscle will allow the muscle to rest for a while, but because the muscle is not keep contracting, then the muscle size will reduce a bit. So even after 4 to 6 months later, when we reassess the muscle bulk again, it's definitely way much smaller compared to before. So because of this understanding, so we wouldn't recommend the patients to keep repeating botulinum toxin A every 3 months. We will only do that up till we achieve the level of muscle mass that we wanted to achieve. Then eventually we can increase the interval of treatment. So some patients we aim to treat the muscle every 3 months once, and some patients we will increase the interval to 4 to 6 months once, and some patients with the aim of just maintenance only, we can even treat the muscles 7 to 8 months once. So it's a treatment that we are able to personalize to individual patients rather than we doing it for the sake of doing it. Okay, now let's showcase the forehead muscle botulinum toxin A results. So looking at this before and after, so one thing which is extremely important, botulinum toxin A, our aim is to raise the eyebrow up. So this is also one of the muscles that will give us the surprise look by raising the eyebrow up. So if we 100% or fully relax the forehead muscle, the patients will feel that there is a big piece of plasticine on top of the forehead. And this will make them look very tired, or they will make them feel tired, having said that they don't look tired. Can you get me? Feeling tired and look tired are different. So most of the time, one of the commonest worry that patients have, especially if you are the first time Botox or botulinum toxin A user, after the forehead treatment, then they will feel that there is a piece of plasticine that's stuck on the forehead that making them having difficulty in raising the eyebrow up. So in these conditions, then they will usually quickly call us, I think my brow is dropping. I need an assessment. Do not worry too much. If you do feel that, you can contact your healthcare practitioner and do a proper assessment of comparison of before and after photo. Then you will be able to know whether is it just by feelings only or is it really you have the brow ptosis. Okay, so I do prepare another photo which I would like to showcase to you. This time round is a female photo. So can you get me the photos of a lady in a resting position? So of what you can see here, this is the treatment area, exactly the same. Every single point of injections is 4 units. So in total, the full face, we give it 64 unit of botulinum toxin A treatment. And this 64, we are referring to Botox, which is a brand of botulinum toxin A that we are using. And can you showcase the before and after? Okay, when the patient's in animations, exactly the same dose, but because the muscle mass is in S or M size, so you do notice there is 100% reductions of wrinkle at the crow's feet area. And when you're looking at the before and after, having said there is no other treatment except botulinum toxin, you do notice that the cheek of the patient is slightly lifted as well. Having said we didn't treat the mid and the lower face. So can you maybe showcase the other photo, like when the patient is frowning? Okay, this is a photo when the patient's in elevations of the lift up the eyebrow in assessment of the forehead line. So because this muscle mass is S or M size, so exactly 64 unit of botulinum toxin A, you do see almost 100% of horizontal line reductions. What I want you to observe here, not only the wrinkle reductions on the forehead, what I want you to observe here is the untreated face of the lower part of the face. Can you maybe please put the photo up again? So untreated lower face, having when the patients raise the eyebrow up, you do notice the cheek and the lower face is in lifting conditions as well. So this is indirect effect of botulinum toxin A. And now, can you please maybe showcase another photo where the patient is frowning? Let's give a moment. This is still a surprise look. Yes. So now, can you see that the patient's in frowning mode? So because, again, the wrinkle is S and M size, when we treat with exactly the same dosage, frowning in this particular patient is 100% eliminated, where the muscle is not moving at all. So when the muscle is not moving at all, besides the upper face improvement, if you do observe at the lower face of the patient's indirect effect, there is also a lifting on the cheek and there is a lifting on the lower part of the face. All right, can you get me a patient's photo in resting position? All right, so now assessing the patient's before and after photo again when the patient is resting positions, you will also notice that resting mode before and after, there is significant glow on the skin on the forehead frown line crow's feet area. And if you observe on the mid and the lower part of the face, there are significant lifting. So this is the indirect effect of botulinum toxin A as well. All right, and now let's come back. Okay, so the moment many of you may been waiting for, our grand prize giveaway. Tonight, the special prize will be in-body body composition test. Okay, have you done an in-body test before? This is a test which will help you truly understand your fat and muscle distributions. Like today, we are talking about muscle distribution. And this test will be able to give you information about your skeletal muscle mass. So, many weight loss journey you undertake is balanced and healthy, never extreme in ways that will be able to compromise your facial structure or overall vitality. The reason why this test is important is because sometimes when you have weight loss, the weight loss is reductions of the skeletal muscle mass rather than reductions of percentage of body fat. So sometimes a healthy weight loss or alternatively, sometimes when you have weight gain, the gain might be in a skeletal muscle mass, which is a healthy weight gain, rather than increase in the percentage of body fat. So if you have done an assessment with the in-body test, after the assessment, our clinic professional nutritionist will provide you with a personalized guidance, including a practical, sustainable eating plan, lifestyle adjustments which will tailor to your personal requirement, and then followed by an evidence-based strategy to help you to restore your ideal body conditions, which is the correct and healthy way. So, stand a chance to win and simply answer the questions in the comment. Do fine lines and wrinkles affect facial expressions and overall emotional presentations? Give us your answer. A for yes, or you can just type A or B, or yes or no. So please type your answer now in the comment, and one lucky winner will be randomly selected for this grand prize. Okay, so if you do have any questions, don't be hesitate. Please continue to type in the comment column. We will find times to answer that. And let's check on this. Okay, so I have a questions here. Before we end the sessions, maybe I answer the last questions. Can PRP be effective for forehead lines and wrinkles reductions instead of Botox? Okay, so PRP is a type of regenerative treatment where we draw the patient's blood and we process it, and then we will be able to obtain a platelet-rich plasma. This platelet-rich plasma will be containing a lot of growth factor and nutrition. So when we inject this PRP at the treated area or treated skin, what will happen? It will trigger skin repair and regenerations. It's extremely effective for static lines or for dry skin because PRP will be able to hydrate, repair, and regenerate the skin. It will be able to help to reduce redness and at the same time reduce the pigmentations as well. However, one thing PRP can't do where Botox able to perform is reductions of dynamic lines. So botulinum toxin A or Botox able to help to reduce the muscle movement, whereas the PRP, the aim is to improve the skin quality from the perspective of hydrations, thickness, color, and sensitivity. Okay, I hope this answer your questions, and the winner for the grand prize is Rainy Now. Okay, so we have exceeded some time. So thank you so much for spending this evening with me on the Anna Hu channel. I hope tonight's sessions have given you not only new information and some idea about botulinum toxin A, but also a renewed appreciation for the science and the artistry behind the aesthetic medicines. So please remember, aesthetic treatment is at its most beautiful when it is built on a foundations of true health, the kinds that begins from within. Care for your body, nourish your mind, honor your rest, and your face will reflect that quiet, lasting vitality. Until we meet again next month, take gentle, intentional care of yourself and love yourself to the max. See you then. Bye.